Basics of Brain Aneurysm is dedicated to Stephanie Tubbs Jones, 1949 to 2008. Stephanie Tubbs Jones was the first African-American woman to be elected to Congress from Ohio. She suffered a brain aneurysm on August 19, 2008, while driving in her car. Police saw her drive off the road and rushed her to the hospital. Jones died the next day. Age: 58. Birthplace: Cleveland, Ohio, USA. The basics of brain aneurysm. What is a brain aneurysm? A brain aneurysm is a swollen bulge or ballooning in the wall of a blood vessel in the brain. A small aneurysm often causes no symptoms. But if it grows, an aneurysm can press on nerves inside your brain, causing pain and other symptoms. It can also leak blood or burst, causing a sudden, severe headache. A burst aneurysm is a very serious, life-threatening emergency that needs to be treated right away. It leads to a bleeding, hemorrhagic stroke. A stroke is the term used when a part of the brain is damaged because of a problem with the blood vessels in the brain. The stroke that happens after a brain aneurysm burst is called a subarachnoid hemorrhage. Brain aneurysms are a challenging health issue in Nigeria, with limited access to neurosurgical services and a lack of published data on their epidemiology, diagnosis, and treatment. An estimated 6 million people in Nigeria will develop an intracranial aneurysm in their lifetime. Access to timely neurosurgical services is a challenge, and aneurysm coiling is not available in most centers. Aneurysmal subarachnoid hemorrhage is a challenging pathology to manage, and specialized neurovascular centers are needed to improve care. The mortality rate for aneurysmal subarachnoid hemorrhage is high, with about a third of deaths occurring before the patient reaches the emergency room. What are the symptoms of a brain aneurysm? Most small brain aneurysms cause no symptoms. You may have no signs or symptoms. Your aneurysm may grow, press on nerves, and cause symptoms. Any of the following may mean your aneurysm is large and at risk of bursting. A severe headache on one side of your head. Pain above and behind one or both eyes or sensitivity to light dilated, wide, pupil in one eye. Vision changes, loss of vision in one eye, or double vision. Pain, numbness, or weakness in your face, or not being able to move one side of your face. Eyelid drooping or not being able to move one eye. A stiff neck. Nausea and vomiting. Passing out. Are there things that make people more likely to have a brain aneurysm? Yes. Having a parent, brother, or sister who has an aneurysm makes you more likely to have one. Other things that can raise your chances include having high blood pressure, smoking cigarettes, drinking too much alcohol, using illegal drugs, such as cocaine or amphetamines, taking diet pills. Certain genetic conditions, such as polycystic kidney disease, a connective tissue disorder such as Marfan syndrome or vascular Ehlers-Danlos syndrome, endocarditis, infection in the inner lining of your heart. Avoiding these things might help lower your chance of getting an aneurysm. Are there tests for a brain aneurysm? Yes. If you have symptoms of a brain aneurysm, your doctor might do several different tests, including imaging tests. These tests include a CT scan and an MRI. Both show pictures of your brain. During these tests, you might also get an injection of a dye that makes it easier for doctors to see blood flow in the brain. Lumbar puncture, sometimes called a spinal tap. During this procedure, a doctor puts a needle into your lower back and takes out a small sample of spinal fluid. Spinal fluid is the fluid that surrounds the brain and spinal cord. If this fluid has more red blood cells than usual, you could have a subarachnoid hemorrhage. Cerebral angiogram. For this test, your doctor puts a thin, plastic tube into a large blood vessel, usually near the top of your thigh. Then he or she will advance the tube through your blood vessels past your heart to your brain. Your doctor then injects a dye that shows up on an X-ray. This lets the doctor see the blood vessels in your brain and find the aneurysm. How is a brain aneurysm treated? There are two main ways to treat a brain aneurysm. Surgical clipping. In this surgery, your doctor puts a tiny metal clip on the base of the aneurysm to stop the blood flow to it. Endovascular coiling. The first part of this treatment is like a cerebral angiogram. See above. But instead of injecting dye into the tube, your doctor advances a soft wire up through your blood vessels into the aneurysm. The wire coils up inside the aneurysm and seals it off from the blood vessel. If an aneurysm is leaking or bursting, the doctor will do one of these treatments right away. If it has not burst, you might not be treated. The decision depends on the size of the aneurysm, your age, and whether you have other health problems. MKO Abimbola holds a DOCTORATE degree in Physician Associate Studies from the United States of America. He is a Harvard Medical School scholar. He SPECIALIZES in internal medicine, acute